Okay, Sierra, we're going to go ahead and start with questions. First, I'm going to introduce myself. My name is Holly Farbo. I am the lead academic and industry relations manager for Hygiene. I am a dental hygienist. I've been a hygienist for 21 years. I worked in private practice for 19 years, and I went to an Aspen Dental as a hygienist in the office, and I loved it. And so when I was presented with the opportunity to speak to students and talk to them about Aspen and put some of the myths aside, I jumped at the chance. So now I'm doing this job. And so I have Sierra with me today. So go ahead and introduce yourself, Sierra, and tell us how you got to Aspen.
Hello, I'm Sierra, and yes, I'm a dental hygienist. I've been one for about 7.5 years now. I've been with Aspen for collectively 5 years or so. I did start out initially with our hospital dental clinic, but that was part-time, and Aspen offered me full-time with benefits. And being a poor college student, I had to take that. So whenever I took that, I was traveling 45 minutes away from home for about 9 months, and I ended up getting a job closer to home, about 5 minutes away, with a private practice. And I thought that that would be ideal, but I was wrong. So I landed back at Aspen because I realized how much I truly loved it.
Great. That's a good story. So real quick, I'm going to just explain what a DSO is. Some people have a question. We say DSO. We refer to that for other organizations also. A DSO is a dental support or dental service organization. And what that means is that all of our offices are owned privately by the dentists. They are all under the Aspen umbrella. I work for Aspen Dental Management Incorporated, which is the dental is the management side of it. And what we do is everything non-clinical. So if you had a dentist who got out of dental school and wanted to open a practice, the first thing that he or she would have to do is find a place for their practice. So they would usually find a realtor or someone like that to help them find a place, or maybe buy it from someone that they knew. Then they would have to go in and they would have to get their software system set up, their phone system, all of that. So usually they're hiring some sort of IT person to come in and do their office and set that up. The next would be to hire employees. So looking, job searching for employees, doing all of the interviewing and, getting employees in place, ordering supplies, then come down the road and maybe the office isn't doing so well and they're not marketing good, so they might hire a partner on to do some marketing and try to give them kind of like a financial partner to see where they can go with this. So all of that stuff I just mentioned is stuff that they don't usually teach in dental school, and that is what we do. So our doctors, our hygienists can focus on clinical, treating patients, and we do all the rest. Recruiting, marketing, payroll, all of that is done for the doctor, and so that he or she doesn't have to take that on. So that's a little bit about what a DSO is. So Sierra, we'll start with questions. You'll see me looking back and forth to my computers. I have questions on both sides and people who submit questions either ahead of time or during. So that's what I'm looking at. First question that I start off with, and this is a question that we've had asked multiple times, is why would I leave my private practice after 12 years to come to a DSO? What advice would you give to someone who asks that question?
So advice that I would give to these clinicians that are looking into maybe a change, one, we offer benefits. I know that's a big deal. We have to have benefits. We have to have healthcare. We offer vision. Of course, you get dental, but we get paid time off, the sick days, our vacation, and the holidays. But not just that. Coming to a DSO office compared to private practice, you are equipped with everything there. Whereas private practice, the dentist or the owner may not have the funds or want to put the money into the best equipment, the best hand pieces, best sensors and x-ray machines. And sometimes it can be challenging, working with older equipment. And here at Aspen, we try to stay up to date with everything. That way we can have the best products to use for ourselves and for our patients. And I think the way that we do things at Aspen, as far as we see the new patient, we have a step-by-step protocol with them as far as what x-rays we take, and the exam that's done by the doctor and the hygienist at that first new patient exam. It's just a really, really great comprehensive exam for us to see what all needs to be done. Whereas private practice, with my experience, patient comes in with a problem and they just take an x-ray of that area. They don't get the full mouth series. They don't do the pan. I mean, there could be potential infection that you just are unaware of, because infection doesn't always cause pain. So, with the way we do things, we get the whole story and we can work with that patient to achieve total health for them and to get them comfortable and to get them happy.
Perfect. So you talked about the new patient exam, which is something that I loved and that we do differently than any private practice that I've worked in. So take me through a new patient exam and what that looks like. How does that new patient exam go from start to finish, and explain how that new patient is put into a separate column?
Sure. So with our new patient exam, we obviously get a thorough medical history, make sure that we know everything that's going on with them, because obviously the mouth is attached to the body. So there could be a lot of things that are going on internally that are affecting the mouth, or vice versa. We always get Panorex, and we do a full mouth series of x-rays. That way we can see everything in detail. And when we have the patient come back, we do a perio charting with a hygienist, and the doctor will come in and do their comprehensive exam. The periodontal charting, I really like that we do that on every patient, just because sometimes by looking at a patient, you think that like they may just need a prophy, but until you get in there and start getting those measurements and you're kind of sinking it, or you're seeing all the bleeding, you realize it's more involved. And it may not be scaling and root planing, but it's gingivitis. And I really like at Aspen, we're able to distinctively treatment plan that from like a prophy, or that from scaling and root planing. There's that in between there where, you have that ability to take care of it and give patients the products that they need to help clear that up. And go ahead.
No, I was going to say, because you mentioned products, and some people will ask, about selling. They hear that we have to sell, we have to be salespeople,
Right.
And so that was a little fear of mine, I'll be honest, when I first came in. But can you talk a little bit about the products that you do recommend, and what you order for that?
Sure. So that's the nice thing about being a hygienist with Aspen. You have total autonomy of your ordering. You can order pretty much whatever you want. We have a list or an ordering requisition system that we go on to, that's really easy to navigate to. And they give you a bunch of products that you can choose to order. I always pick Prevident toothpaste. It's one of my favorites. I've been a huge advocate for that ever since I had braces. I've loved it. So I order a couple of different variations of it. Sensitivity, because that's a big thing with most of our patients, is sensitivity. Dry mouth, Prevident, and the Booster Plus for those patients who have a lot of issues with caries and recession. So I like to give that out with the chlorhexidine. I recently did a CE course through Viva Learning that Aspen provides for us. And they were saying about the good correlation between the chlorhexidine and Prevident giving you better results than using Stannis. However, as a hygienist with Aspen, we can order Stannis fluoride mouthwash if we want. You have that control. You do what's best for you and what is best for your patients. And yeah, MI paste is another thing that I order. Pretty much all my patients use the MI paste, which is a wonderful vitamin cream for your teeth. If you're not familiar with it, I love it.
Yeah, I know. And what I loved about Aspen too is, a lot of times in private practice, I would recommend products. I would say to them, you know what, why don't you try Prevident or you try this? But once I got to Aspen and those products were right there on hand for me, I did a lot of independent research on my own and found how useful some of these, I've been as a hygienist for 19 years and didn't realize I recommended them, but I didn't really know. It was kind of just that everyday thing. But once I had them on hand, which we have, a lot of people don't know is that we're Henry Schein's #2, just behind the United States government customer. So we get really great prices on these products, and we have a very wide range of being able to, order that, that we have this on hand. And so we don't just have to recommend it and push them off and say, oh, goodbye, go find it somewhere. We can give those to them there. And that's nice. And some people look at that as though, oh, you're trying to push a product onto me, but it's really not. It's having that availability and access to care is what we're about, which is the thing. Now, one other question I get all the time, or I see this all the time, is that somebody pushed me and gave me a toothbrush that I didn't ask for. Can you explain a little bit why we recommend the Oral-B and why that's in our treatment plans a lot?
Sure. So with Oral-B, we really, really like this toothbrush because it pulsates and it oscillates at the same time. So you get this dual motion clean. It's great for any patient of any age, just because it flutters in between the teeth. You don't have to work on how you brush. You just hold it there. It does all the work for you. In all of my years of doing hygiene, I know when I was in college, we had to use the Oral-B, the Philips Sonicare, the Rotodent. I do research for Colgate, and Colgate was trying to put out a powered toothbrush that's very similar to the Philips Sonicare. But each time I used one for 6 months, I had the best results with the Oral-B. So, I'm glad that we have that option to give to the patients, because from all my years of working with Aspen, I see the biggest difference when my patients do get the Oral-B. And some of them, initially they decline it because of the cost, but we are able to sell it as cheap as we possibly can because we're able to buy in bulk. And the same toothbrush, it's the most professional series that you can possibly get. Oral-B still sells it for $200 on their website, and we sell it for $135 and do a 2-year warranty. We give you a $20 mail-in rebate. Sometimes they do a $30 mail-in rebate around the holidays. But we give you like the toothpaste. It's a whole bundle. But some of my patients, like I said, who initially decline it, I'll eventually talk them into it. And I cannot believe the difference. Yeah. Like, especially these periodontal maintenance patients, ones that build up a lot of stain, they come back and there's like nothing in there. And it's like a blessing for me and for them. So
yeah, I used to get that all the time. And I just used to love to see those results, because it wasn't like we're just talking them into something that's not going to, we would see these patients back, and the results. Yeah. And I had so many people just go on and on about, oh my gosh, I can't believe how great it is. And we know how great it is, right? Which is why we try to educate our patients.
I try to explain to them too, the reason why it gets so expensive is, one, that toothbrush should last you a lifetime. Yeah. But the motor is what you're basically paying for. So like the cheaper models, the motor isn't as powerful. So you're not going to get the same results. And that's what I try to explain to them. But yeah, it's a blessing if patients get it.
It really is. It really is. So, with your new patient exam, what other types of tools do you use to show patients their mouth? Like basically what I'm getting at is the iTero machine. So
Sure.
do you have an iTero machine in your office?
Yes.
Okay. And can you explain a little bit about what the iTero machine is and how we use it other than for Invisalign?
Sure. So the iTero, or our Healthy Mouth Scan, is a great tool to scan the whole mouth and get an image of all the surfaces in the mouth of the teeth. Um, it's nice because we're able to track the bite, and if there's wear, like attrition, bruxism. It's just good to see that and see if the teeth are shifting over time. So each time you come in, like for your 6-month recalls, we would get a scan of your mouth, and just over time we can see if anything has changed. And if we are seeing a lot of wear, which we have this color coding system, it kind of looks like the heat, like you're looking for
Like a thermal.
yeah, that's what it is.
Yeah.
It looks like thermal. Yeah. If we notice that over time, then obviously we want to address it. Maybe we need to look into a night guard, or we need to look into using a prescription strength toothpaste like the Prevident or the Floradex, an MI paste cream to help protect those surfaces so that they don't continue to wear down, where doc would have to do restorative work. So we have all those tools for us at the new patient exam. And of course we have intraoral cameras too, so we can do that. But a lot of patients feel, I feel like the comprehensive exam with the iTero scan is more beneficial for them because they can see everything.
Yeah.
And that's another reason why I like that we have computers at each of our units, because I love pulling up the x-rays for the
Right.
patients to see
Yeah.
and show them the dark spots or bone loss and build
Yeah,
up.
that definitely makes a difference.
Mm-hmm.
So other than cleanings, and again, this is another thing that I liked about Aspen, is I was burned out from prophy all day long.
Yes.
And I have worked at offices that told me, we don't do SRP, we don't do that because we don't want to push our patients away.
Right.
So it was just, polish or prophy jet or, whatever someone. So what other types of procedures or other than cleanings? So go over what other types of things that you do for your patient, and how you manage your time with prophies compared to SRPs or gingivitis treatments.
Sure. So other services that we provide are scaling and root planing. Sometimes we have to do debridements if the patient presents at the new patient exam. A lot of heavy buildup where the doctor cannot finish the comprehensive exam without removing some of that calculus. We do Zoom whitening. We do that in the office, or if the patient prefers to do take-home trays, then we'll whip up those alginate impressions and get those made for them. And we can get patients numb if that's, legal in your state for a hygienist to do. And microabrasion, that's one of my favorite services. I like that. And that's for the white spots on the teeth. And I'm trying to think what else. The gingivitis, the gingival therapy appointments. And you have total control over your schedule on the length of the appointments. I know there's times when I have a really, really involved periodontal patient that I know is going to take me a long time to scale, especially if they need antibiotics below the gum line, like a Resin or Atrodox. I will let my office manager know, like, I'm going to need a lot of time, and they're more than happy to find a spot for that patient where I have ample time with them. Sometimes even a gingivitis patient where, usually that appointment might take you only 45 minutes. There's some that I have that take me about an hour, and I will let my office manager know so that they don't try to put someone in like right after that patient. But I mean, even prophies, like I have some difficult prophies because of stain, and I'll make a note and say, I need an hour for this patient. And there's no questioning. They know that we're the clinician. We know, what we need, and they don't argue.
Yeah, right. How about the oral cancer screenings? I'm not sure
Oh,
what you have
yes,
in your
yes.
office. What do you
Yes.
have?
So, well, we have Velascope, but I had oral
Mhm.
ID whenever I worked up in New York, Aspen.
Yeah, so it depends on the office and the doctor. Some of the offices have the oral ID, some have the Velscope. But yeah, the oral cancer screening is a nice thing. So in your office, you have more than one hygienist. I was a one hygienist office when I worked in the Indiana office. Can you tell us how? So you're the lead hygienist in your office?
Well, I I was the lead at one point, but when I made the transfer, the hygienist that is with me right now, she was also the lead. So we kind of we kind of got rid of those roles, those titles in our office, just because we're so strong
Right.
clinicians as far as like treatment planning goes. So we we don't do that in our office.
Okay.
We
So
do a
can you
little
just
bit different.
Okay, so can you explain like what that may look like since you had done it
Sure.
before? What a lead, if you were in an office where you had a lead and an associate hygienist compared to two leads or just a single office?
Sure. So, with a lead, they tend to do more of the treatment planning with the new patients. We might just have a way of talking to these patients and making them understand why treatment is necessary, especially if they need dental work. We need to get their foundation nice and healthy before doc goes in to do any kind of dental work so that it actually lasts and holds up for them. Um, so we also, as a lead hygienist, we're in charge of our ordering. And that's very, very simple. I mean, you collaborate with the other hygienist, the associate hygienist, and you talk about what you need and what you're low on, and it's very easy. But you just want to be on top of the schedule, make sure that patients aren't missing their appointments, or patients in doc schedule are you know, on top of their appointments. They didn't fall behind on a cleaning and somehow got in for a filling. No, we want to do that cleaning first before we do that filling. So same thing with the oral cancer screening. If there's a patient in for an extraction, we certainly want to do we certainly want to do the oral cancer before the extraction, so that we can make sure that we don't cut into any abnormal tissue that we can't normally see without that light. So, I mean, it's important that we, keep up with that and make sure that nothing fell through the cracks in the schedule.
So how do you manage your time between your existing patients and your new patients?
So I have an awesome team, and I've had an awesome team even in New York, where the assistants are very good at letting us know that they seated the new patient after their x-rays, and they'll see where we are with our current appointment, the hygiene appointment. And if I'm like almost done with my hygiene appointment, I'll let them know. And so what they'll do is they'll start getting an iTero healthy mouth scan on them. And they will actually pull up the perio chart for me and start asking the questions in the perio chart. We do have basic questions in the perio chart, but I also made up my own specific template for them to pull up and start asking the patient. And that helps me out a little bit so that I can, finish up my current patient, get them dismissed, and walk back to the new patient. And I usually have ample time with all of that. But our assistants are very good at making sure that we have a good flow, and that no one's waiting too long, in the chair for
And
any of
honestly, that's
us.
the whole office flow. And when you have a good team like that, I mean, that goes to say with whether you're at a private practice or Aspen or anywhere. When you have a
Right.
good team, things flow,
Right.
so I always talk to hygiene students, and one of the first things that I want to tell them is that, sometimes it comes down to you and the person that you are. Communication is key. You have to be
Yes.
willing to help if you want help. Those are just basic life skills that I think sometimes kind of push it by the wayside. And I hear people complain, oh, Aspen this, and I'm like, well, maybe what you're telling me isn't about Aspen. Like, I think that you may
Right.
have that problem in any office. It's the same, you have to, be a team player. And that is what we're about here at Aspen. We
Yes.
love our teams. We're very team oriented because it just makes everybody's job and life so much easier. So speaking of new grads, do we hire new grads? Is that something that we do in our offices?
Yes.
And what kind of training do they
Yes.
get? So going into a new office, if you had a new grad coming in, a
Sure.
big question that they always have is, I have a 4-hour cleaning and I'm scared to death to walk into an office and get thrown 10 patients and on my own. So walk through, and this goes for both new grads and existing, because I did this. What kind of training do you have for a new hygienist coming in?
So we do have a hygiene orientation program called HOP. And it's a great program because it does go through everything as far as what we deal with on a daily basis, as far as the types of treatment that we're able to provide. And it also goes over like the incentive plan, how that is paid out. And I mean, it pretty much answers all your questions as far as being a hygienist in Aspen. Um, it just doesn't leave you hanging, and it's really, really great whenever, you don't have to be just a new graduate. It's for all hygienists to go through and act as like a refresher and really understand your purpose of being a hygienist, and not just a dental hygienist walking into the office day by day doing prophy after prophy. It's just not like that. You're utilizing all of your skills that you learned in college, which is great. I know I've worked with hygienists in the past that have done prophy after prophy, and I talk to them to this day, and they're like, I don't think I could ever do a scaling at this point, and it's sad. But yes, this hygiene orientation program, I feel like, answers a lot of questions and concerns that a lot of us have. I mean, all of us are nervous when we start somewhere new, even when we're newly graduated, whenever you leave college. And I've always said, even when I left Aspen the first time to go to private practice, I've always said I learned the most working at Aspen because I was able to utilize everything. We do so much as a dental office in Aspen, where I was able to collaborate with a doctor, our lab tech, and see what was going on. What were they doing? Because I want to know what they do on a daily basis, so I can have that opportunity to help our patients out and answer those questions for them. It's just a wonderful place to have all of that for us, and not be so simple minded. So
Right,
yeah.
right. So as far as, we'll cut to the chase. As far as compensation is always a big thing that people ask about, obviously. I mean, that's why we work. And so there's a lot of misconceptions about Aspen DSOs, as far as commission, that we work on commission, that we get sent home if we don't have a patient. Can you talk just a little bit about that? Everybody's different. Pennsylvania, the pay there might be different than Missouri or California.
Sure.
It's just different areas and regions. But can you explain how the pay kind of goes that way?
Sure. So you do get a base pay, so which would be your hourly pay. Now you do have the potential to bonus every month. There are a couple of different incentives there. There's one for the whole office, and then there's one based off of your performance. Now, it will definitely vary because that is based off of the production that you bring in that month. how much you spend in your supplies, what you're ordering for the patients. And that includes like your prescription straight toothpaste, your mouthwash, your toothbrushes, your atrodoxoricin, all that. And then it also, it depends on how many hours you work as well. Like that all gets factored in. So, if you're not being productive and you're just kind of like there getting your 8 hours and you're not seeing a whole lot of like scaling and root planings or gingivitis patients or whitening, and it's just prophy, you may have a lower incentive than you would on a month where, let's say, you get to leave early every day, but you had at least one scaling every day. You might get a bigger bonus at that. So, I mean, it all just depends on the schedule and what you have. But I can say this, I certainly make a lot more than what I did in private practice, because I know some people, they say, oh, I got offered more in private practice than I did at Aspen. Well, you really don't know that until you start working at Aspen and you get those incentives.
Right. And I've seen incentives be more than paychecks sometimes, and
Yes. Yeah.
and honestly,
Yeah.
I worked in an office where we were a little less busy. We were just in an area. First of all, you never have a lack of perio patients. People that,
Right.
there's just, you don't have to make that up. I mean, it's there. It's definitely there. People are undertreated. They've been undertreated for years. So that's never an issue. And I didn't have I think they made it pretty, pretty not easy, but I mean, I think it was very achievable to be able to get a bonus and incentive.
Yes. Yes. It's very attainable. I mean, before you know it, your schedule's packed full of very, I don't know how to word it, but the appointments are definitely more expensive than like just a prophy. And honestly, I feel like a lot of my patients need products whenever they're in my chair, like even just a prophy. I feel like most of my patients complain about sensitivity, and I hand out MI paste and Prevident left and right with all those, and the patients, they're like, no one's ever offered me this before, and they're so thankful, and once they start using it, they don't want to go back, and our patients are very, very thankful for that, and they will come in without, they don't need an appointment, but they'll come in and they'll say, I need more Prevident or I need more MI paste, and I'm so happy that they do that, because I'm telling you, it makes your job so much easier when they use those products.
Yeah,
It really does.
And sometimes the backstory of, explain a little bit about what type of patient we generally see. More than likely, we're not seeing the patient that's, coming, and we do have that, but what type of patient usually comes to Aspen at the very beginning?
So usually patients come in when they are experiencing a problem. And we have a lot of older patients that think like dentures are the solution, and that's what they come for. Until we do that thorough comprehensive exam, they find out that no, they don't really need just dentures. Maybe they need a partial, but we explain to them, we don't like to pull teeth if we don't have to. Nothing is better than your real teeth. So we end up doing periodontal cleanings on them, and I know in my case, we're right next to Penn State University. So we get a lot of college students that come in that are like real interested in whitening. So, of course, we got to get their cleaning done first, and then we can do the whitening. But we get patients of all different types with all different problems, and it's just important to, of course, address their problem and their main concern, but to let them know that there may be other things going on in there that are attributing to that concern that they have, so that we don't hide any kind of secret from them. Everything is there. They see the x-rays. We show them the difference in the shading, and we let them know what we can do to get them happy again.
Right. And it depends, again, like you said, you're right next to a university. So you may have an office where you have a little bit more prophies or gingivitis patients,
Yeah.
you know, on a daily basis, because you have college students and, you know, somewhere in another area. And that's part of Aspen's appeal, is that we have a lot of offices, but we have them in areas where there is, you know, not real great access to care. And patients, so patients have that opportunity to get dental care. And a lot of times we have patients that haven't been to the dentist in years and years and years. So maybe 20 years ago, they did have a cleaning, but now, you know, after 20 years, you don't just have, you know, all these cavities, you have periodontal disease. And, you know, and sometimes that is a patient who will resist you and quite honestly complain that we gave them too much of a treatment plan. But so if you kind of understand our patient base, sometimes that's a little bit more easily understandable, especially to, you know, hygienists. When I tell students that, they totally get it, because they deal with patients like that too. So what kind of specialists do we have? Do we have any specialists? And when, you know, what do you refer out for perio ever?
Yeah, we certainly do refer out to perio on occasion when, let's say the patient has a lot of like 8mm, 9mm, even 7mm pockets, and they just cannot afford treatment with the Arrestin or Atrodox. As a clinician, I don't feel comfortable just doing the scaling on them and letting them go without the antibiotics below the gum line. So just to protect myself, I refer them out to perio when it comes down to something like that. But a patient who, you know, has generalized 5s, 6s, maybe a few 7s here and there, we can, you know, keep them. We'll do the scaling there. Let's say that they don't get all sites of Arrestin or Atrodox. We can place, you know, the antibiotic in the deeper pockets and let them know, look, your 5s and 6s, or just the 5s, may not heal the way we want it to without the antibiotic. But when you come back in 3 months, we'll reevaluate and see how they're looking. If they're not improving, we got to do something more. Mm-hmm. And usually they're very understanding, and you know, they know, especially with that medical history, you know, if they have something going on like heart problems and diabetes or arthritis, we let them know that we can't just ignore the active infection. We have to go at it aggressively and put it in remission. So it's really important. And I've had patients in the past where their doctor was helping them with their diabetes, and they were on them about, you know, are you getting your dental cleanings done? Are you getting the right treatment? And the patient would be like, they asked me if it, and I'm like, yes, that's what we're doing. We're addressing the periodontal disease so that it doesn't affect the diabetes and your A1C levels and things like that. So, I mean, it's great. I love when I hear doctors outside of dentistry ask if their patients are keeping up with it, because they know that the mouth is attached to the body. So
right. This is part of your body.
Yeah.
Yeah. So how about endodontists or oral surgeons?
Yeah, so we do have specialists that come into our office once or twice a month. My office currently does not have an endodontist that comes to us, but we do have a good relationship with a local endodontist that we do refer to him. But we have a wonderful oral surgeon that's in our office. Seems like twice a month anymore.
Is it Dr. Cirillo?
It is.
Yeah. He was on one of these AMAs. He did one. Yeah, he was I know, I love Dr. Cirillo. He's great.
Yes.
So how about CE? Do we offer CE for our employees?
Yes, and Aspen is really, really good at keeping us posted on when there's going to be live CEs. Um, and, over quarantine, they provided us with a lot of live CEs and other learning and development courses that we could use towards our CE credits. Um, but they do partner with Viva Learning, and so Viva Learning is always at our access at work. And from our phone, we can do it at home. You can do it in your downtime at work if there's absolutely nothing going on, to earn those credits. But they are very, very good at updating us.
And those are all provided free for you, correct?
They are
Good.
all
We also offer we did over the COVID to outside hygienists. We offered all types of free CE because we realized, how important that is and that people didn't have access to that. So, we're always looking out. Hygiene is very important to us here at Aspen. So going on that question, a lot of the dental hygiene students are very big into community dental health and giving back to the community. So they always ask me kind of what we do at Aspen for that. So can you kind of go over the few community services we do?
Sure. So we offer a couple different things. Every year we always do Day of Service. It's usually in June, and that is for our veteran patients who do not have insurance. And that day, it's great because the patients that come in, we offer the treatment to them at no cost. And then I know in our area, our dentist likes to pick one patient to do all the work for them. So let me go back a little bit. When they come in for their treatment that day, whatever we get done that day, it's free. But if a patient needs a lot of dental work and they happen to be the pick that the dentist chose, then we will have them come back and continue to do the work for free for them. We also have our Aspen Dental Mouth Mobile, which they travel across the country and they go to different places that are in need of dental support. So, that's taking care of our own US citizens. And then we also have mission work where our company will choose some some of our employees to do a community outreach program in an undeserved country. And that's a really, really cool experience. I was really interested in the Trinidad one that we had not long ago, but I mean, I've heard such wonderful stories about these people going and the experience that they had. Our lead hygienist up in New York at one of our other offices, she went, I think it was to Guatemala, and it just looked like they had a wonderful time. And just the feeling that you give of giving back to those kids and to those families that don't get that kind of treatment or that work. It's awesome that we're able to do something like that and have that experience. And I just love it.
And this is honestly why we always, hygienists got into this, is to help people. And, over the years where I felt like I was under appreciated, to put it that way, I didn't feel like I lost that. I just kind of went to work every day. And with Aspen, and because of a lot of these, I got that renewed love for that, and that passion for helping people. So we'll talk real quick about the COVID situation. And
Sure.
So the question is, do you feel safe? Do you have adequate PPE? And I know this is a three-part question. How has your appointment changed for your patients? So do you feel safe?
I do feel safe. Yes, they provided us with plenty of PPE. I wear loops, so we had a couple different types of face shields that were given to us, based off of, clinician and what we wear under that. Um, Aspen has always provided us with lab coats, so that's never changed. So we do wear those, but we also wear disposable gowns over our lab coat that we can, change as often as we need to. They also provide us with like a hair net type thing. I mean, it's thicker material obviously than a hair net, and it is water resistant. So they gave us those, and we have lots of level 3 and N95 masks. They're always sending us plenty of Cavicide by the gallons, and Cavi wipes. I'm trying to think, what else do we have? Well, so I know we also had to change a little bit of our protocol too. Whenever we come into the office, we have to change our shoes. We can't leave the office in our scrubs, so we all change our, out of our scrubs before we leave. Obviously, more frequent hand washing. That really hasn't changed, but we have hand sanitizer everywhere. We do make sure that the patients wash their hands before and after treatment. Just
You
to
do
be
temperature
extra
checks?
careful. We do temperature checks, and they fill out forms every time that they come in. So, even if the patient was here today and they're coming tomorrow, they're going to fill out the same forms and get the same temperature, or they're going to get their temperature checked. But the forms just ask, have they traveled out of the country recently? Have they traveled out of the state recently, within the past 2 weeks? Or, have you been feeling sick, or have you been near anyone that was sick? Things like that. And I've had a patient within the past month, he was feeling kind of sick, like he had a cough, and I said, oh, we got to reschedule you, and he was okay with that. And I have so many patients that are thankful for us, for the protocols that we had put in place, as far as the washing their hands, spraying their hands down with hand sanitizer, and watching us spray down the units to let it sit for 5 minutes or so. But we are given ample time in between our appointments to make sure that we can thoroughly spray the units down, let them sit, wipe, get our instruments taken care of, and sterilization. And I mean, and it's also our call too, as a clinician. If we start to feel rushed, we can tell our front office, like, hey, I need you to slow it down a little bit. I can't have this many patients, and they're very understanding. They get it. We're the clinician. We know what's best. They're not going to argue with us.
Right. So sometimes I'll get the question, and now with what's been going on with COVID and stuff, is that there are some, hygienists that are burned out and looking for other things. We do offer growth in this business, obviously. I'm one of those people, but we have a couple roles outside of our clinical hygienists. So one of the roles is a territory hygiene manager and division director. Can you explain a little bit about what your territory hygiene manager does for you as far as your support?
Yeah, so just like the title says, they are there to offer support and keep us on the right track. So sorry, my puppies just walked in.
That's okay. We like puppies. That happens.
So anyways, yeah, they're there to offer the support that we need, guidance. If we have concerns, questions, they're always a text and email away. I feel like I text mine, maybe once a week, once every 2 weeks, with questions, or, it's just, they're there to help you. And if they notice that maybe like you're falling behind on something, maybe you're not getting enough of your iTero scans in for the healthy mouth scan, they'll nudge you a little bit and say, hey, it's important that you get these done. It's important that we see the differences in these patients' mouths each visit they come in, because there could be something there that we just haven't caught until maybe like the third, fourth appointment of doing these scans, and we see like, look at all that wear on their teeth.
Right.
Let's show this to the patient. But yeah, it's definitely a great support system that we have with, because you just don't feel alone. That's the nice thing about it. You have that whole network, even the other hygienists, the other girls in the territory or the region, if you want to reach out to them, I feel like we easily could. With the text chains that we have or the emails, it's so easy to type in a name and the email pops right up, and it's great to have that network.
It is. And sometimes as a hygienist in a private practice, you feel like you're on an island all yourself. And if other people aren't supportive of you in the office, then you really have no one to ask unless you go to an outside CE class or maybe get on one of these forums. But with Aspen, you always have those people. I worked very briefly at another very small local DSO, and they had some sort of a territory manager, and the person said to me, oh, they're from Florida and all they do is call up and tell us what we're doing wrong and complain. So I was so happy when I went in that, my territory hygiene manager was so supportive. I never felt pressured. I never felt like she was, telling me what I was doing wrong. I was actually the opposite. It was actually praise and positive reinforcement. And, these people are put into these positions that have been, either in those types of positions, or they've been Aspen hygienists that showed really great promise and, wanted to go on to something non-clinical. So, they've been there, they know, and they know the job, and that's really important. So I love that part of it. So that is, okay, let me see. Perfect. All right. Well, I have one more question for you, because this time just flew. Sierra, I was hanging on your every word. You did great. Thank you. This time just flew. So one more question that I always, kind of end with. And at Aspen, we are what we call a yes organization. So if you could just tell me a little bit about what that means and how that has impacted you.
So as far as being a yes organization, that is ultimately getting the patient to feel comfortable with what we're treatment planning for them, to make them understand the need for their treatment. And once they have that understanding and they feel that comfortability with not just the hygienist, but the dentist and, the assistants, even the office manager, all of us play a key role in everything. They're more inclined to say yes, and they're more inclined to listen to us and have that trust within us and what we're providing for them. I feel like yes also applies to us coworkers. Yes, we want to feel confident in what we do. We want to feel like a family. We want that just that closeness, because I feel like if we're all on the same page, it makes getting yes easier for everyone, for the patient. And, it helps so much when we're all on the same page and we can talk to the patients about everything. It's good to understand your doctor and to know how they treatment plan and what they expect from you. That way you just have a smooth day.
Right, exactly. And so I will finish with what my yes is. And, I lost kind of faith in dental hygiene in my career. I was burnt out and I just didn't feel valued. And so I was able to come to Aspen and be able to say yes to my career and yes to my patients, and to the point of, finding that energy to say, this is what it's all about. This is what hygiene should have been through my career, and I regret not coming here sooner. So thank you very much. I appreciate your time. I will reach out to anybody that has any other questions, or I will send this AMA to you. So thank you, Sierra, and I look forward to talking
Thank
to you
you,
again.
Holly.
Yes, have a
Yes.
great night. Thank you.
You
All
too.
right,
Bye.
bye-bye.